So as a summary, what would you say is your philosophy? How you deal with pain, how you deal with health, how you deal with all the consequences of these things?
It's kind of like a choice. It's just choice when you get up in the morning. Like I said, it's like getting up this morning. I have to be up at 5 a.m. I have to be helped out of my bed and braces and all that to get upright. And I could go to that point of the pain, the discomfort, you know. But the first thing I roll over and look at is I have a roof over my head, I have a cup of coffee, and I'm alive.
Yeah.
In the frame of mind, I'm still good with my frame of mind.
And that's something that's yours, that
Yes.
no matter what else is going on outside you, you have say over it.
And that's where I always say it's my world.
Yeah.
This is my world. So I control everything in my world. So nothing disrupts it unless I allow it.
Okay.
And like I said, it's when I've fallen a few times, Linda will get worried, the worried upset part, but I try not I try not to go to the despair of laying there. It's just getting up.
Sure.
Or sitting there.
So, and that's the goal. I mean,
Yeah.
and obviously you're considerate of how she feels. You know that she cares about you and she might worry.
Yeah.
But you know that you are able to take care of the situation. It's just a matter of what do I do next? What's the next best thing to do?
And we always, having a good partner or even a good home health aide that works with you in your situations, she's there to help me, I'd say like, not to coddle, not to oh poor you.
You don't want that. I know you don't want that.
I don't want that. I want help. I like I prefer the calm instead of getting upset like when I fell in the store.
Oh,
yeah. That one there, everyone gets panicked and it's like just take a deep breath. It's like meditation.
Very good.
You bring yourself to a center and work from it. If you automatically go to a disruption, it kind of gets everyone else disrupted.
Yeah.
So if you can keep a peace to around you, it works better. Getting up, the falling.
So when something like that fall in the store, I mean, falling is like, oh shoot,
Yeah.
fell. So there's that immediate response, but then it's like, okay, what do I do next?
That's it.
That mindfulness approach of looking at the situation and saying, what is the next thing to do? What's the next step?
Yeah, and I don't go to the pain. I mean, I try not, even though it hurts, I try not to automatically go to the pain and lay there. I mean, it's, it hurts, but it's the part of just sitting there for a minute, getting yourself in that place, and then working from that. But yeah, there was a time that I did that. I would do the, lose a grip, and I notice now that it's a little bit easier if I just keep control of the situation.
How would you say that changed over time from having a meltdown to having that kind of, let me deal with this?
It's been a long journey. I mean, it's
not short.
Not a short trip to get this point. Trial and error.
Okay, so there's no one fixed formula.
Yeah. I mean, even today, I still have my moments of disrupt that, like I said, when I fell in the garage, I hit my face on the side of the table and everything, and I rolled over.
Not a good situation.
Not a good situation, so I did kind of lose it for a minute till I...
Exactly. That's natural to lose it for a minute, but you don't want that to get into a snowball down the mountain.
Yeah. So like I said, in the time, I've learned, it's better if I just come to a center and go from there than laying there and cussing and screaming and yelling at everybody. And
well, and without without sounding corny, when you say trial and error, it seems as though along the way you've looked at these things as learning experiences. Like,
Oh,
okay, what good did that do?
yeah.
Having a meltdown versus what good did it do as you more recently approach it? It's like it's the best thing to do after something like that has happened.
Yeah. I was just, like I said, it's when you melt down, everyone melts down. So it doesn't make the situation any better. It just enhances it to a. So when they see me calm, they can usually keep pretty calm.
So you can't control them. That's not the idea.
No.
But you can have an impact on how they respond to it
Yeah.
by how you're responding.
Yeah.
Yeah. No,
Yeah.
it's more of a positive cycle, even at that. No, I mean, falling obviously is something that happens occasionally. Unfortunately, it does occur. But on an everyday basis, though, it seems as though you don't let the pain control you. You're aware of it, but you don't get consumed by it.
No. I try to put myself in the space around me, like nature, the room,
Excellent point.
you know, things around me that will take. I don't give the pain power. You know, if I sat there and thought how bad I hurt just walking up that hallway and sat here and just kept processing that continuously, then that's all I'm going to be consumed by is the pain. But if I can sit here and, like I said, I glance out the window and I see the bushes.
Yes.
I see the sunshine.
Yes.
You know, I'm sitting in the room, I see the table, the things around me, and it's like, it's a very comfortable, peaceful thing. Not the pain where, like I said, I have it shooting up my hip and into my back, and, you know, sometimes I can't get up and sometimes it hurts to sit down. I mean, it's...
Well, and what I'm hearing there too, Steve, is that you can find that anywhere. I mean, you're sitting in an office in a professional building.
Yeah.
About a table and looking out the window, as opposed to your beautiful backyard with the
Yeah.
trees and the bushes and the grass.
And you
the
can find
flowers.
it anywhere.
Exactly. You're able, if you look, it's there.
Yeah.
It's a matter of finding it and looking for it.
It's like I was saying, like the cup of coffee in the morning. You know, I focus on when I get out of bed, that cup of coffee. I have a lot of people, my brother's one of them that says, I can't find anything in a cup of coffee to make me happy. And it's like, but I can. You can find happiness in about anything if you look. I mean, me, it's like when I get up in the morning, I'm happy to get up. It's really happy when I have that hot cup of coffee sitting there and it's the start of my day. I'm not thinking the rest of the day. I'm thinking about that cup of coffee.
You're in the moment.
I'm in the moment.
You're really in the moment. I mean, people use that term a lot, but you really are practicing it.
Yeah.
And you find the benefit. I mean, it does really make a difference.
It makes a big difference because I have friends that sit there and they start off with a pile of papers in front of them. You know, their doctor's appointments and everything like that, and they start getting worked up, and it's like, let's start with a cup of coffee, a glass of juice, something, glass of water, maybe nothing. But just sit down and start your day. You know, start your day in a peaceful manner, then walk into it like, okay, I have this to take care of. I have this to take care of. Don't let it overwhelm you. If you let it overwhelm you from the beginning, then your whole day is that. It's going to be an overwhelming day
You're
of...
setting yourself up.
You're setting yourself up for failure.
Yeah.
Me, I just got to that point of, and it's trial and error, that I've realized that when I get up, I'll get done what I get done, and what I don't, I don't.
I mean, we've talked about this, and I think we both know from talking with others, is that generally people dealing with health conditions and pain, they talk about having good days and bad days.
Yeah.
And no matter how good or bad, there is some differences there. So you do your best to make every day a good day as much as possible, but some days are rougher than others. But
Yeah.
in those days, you say there are some basic things that you focus on.
Like I said, when I get up in the morning, if I can just make it to my chair, that's a good day. I mean, I have days to where my legs hurt so bad and my body and my back and everything, I can't breathe because of the humidity. When the humidity gets real strong, I would love to sit outside. I can't. You know, I can't breathe. It's like the trial and error thing. I have tried a lot of different medications over the years.
Oh, yes.
a lot.
And you do have a number of health conditions.
Oh, yes, I have a number of health conditions. And I give my doctors full reign to a point.
Okay.
You know, the surgeries they've offered me to fix things,
Yeah.
you know, things like that. I have had probably over 90 surgeries.
Literally 90?
90.
Oh my gosh.
On every joint and every piece of my body. I know what it does. I get up in the mornings and the doctors say, well, this could make you better. Okay. It could not make me better.
Yeah.
You know,
Okay.
the medication. Well, if you try this, it may work. It may not. Do I want to get up and, like I said, back in the beginning, I was taking I don't know, it was like a shot glass or a juice glass full of pills every morning. Every morning. You know, I don't do that any longer, and I feel the same as when I took the whole thing of pills. I mean,
you gave that a fair trial.
I gave it a fair trial.
You gave it a fair
The
trial.
medication is like,
Yeah.
you know, you can take the medication to help your arthritis. I have osteo and I have rheumatoid arthritis in my joints. Well, you could take this and it may help you. Okay, I give it a try. And if it doesn't work, I go back to the doctor and say, well, I tried it for this amount of time. I just don't prefer to continue taking something.
So you're very actively involved in your care. You
Yes.
speak up, you ask questions, you listen to what's recommended,
Yep.
you consider it. And that seems to be really, you're doing your part of the team, because just going to the doctor and having the doctor tell you what to do and not even understanding it, or
And a lot of them don't.
Well-
A lot of them don't understand and I've been called disgruntled.
Yeah.
You know,
I've
I'm
seen that in the
hard-headed.
chart. Yeah.
I've been
I've seen
hard-headed.
that in the chart, yeah.
And it's not. I'm never argumentative. I'm pretty decisive on what I want and how I want it. I've tried the pain medications. I've tried all that to feel better. The side effects and stuff like that
Yeah.
are not, you know, the one for my arthritis stuff. It makes me nauseous.
Yeah.
So I can't drink the coffee, or sometimes I can't eat.
Oh my, what a trade-off that is.
You know,
Yeah.
and then you go back to the doctor and say, well, this has made me nauseous. Well, that can't make you nauseous. Well, I'm sorry, but it does make me nauseous. You know, it's like, so I prefer to get up in the morning and not be nauseous and drink my coffee on my patio.
Well, you're talking about, what I'm hearing is the quality of life. You're talking
Yes.
about the quality of your life, and that's something that's very personal, and you determine that. And it's not just symptom remission, it's not just exhausting all possible procedures or medications, it's a matter of balance.
Yeah.
You want benefit, you do take some medications, and you also have tried others and you
Yeah.
decline. But it's to attain a balance, and having that quality of life is what I'm hearing.
And I always go back to that from the doctor's creed. It's my wellness and happiness you should be thinking of.
Yeah. Mhm.
And that's what I'm doing.
Well, and in a sense that you should be doing that.
Yeah.
I mean, it's your life. And the medical community, doctors and others are doing what they can to help you by offering you opinions, recommendations, suggestions. But ultimately, it's your decision
Yes.
among those recommendations what you believe is best for you. So I
That
know you
works.
listen.
That works. That
Yeah,
works for me.
That works.
And like I said, I listen very well to what they have to say. You know, I take most of them. I take most of their opinions to heart. You know, but at the end of the day, it's me.
Yeah.
It's my world that I call it. That it's all about me. It's that, I guess, self-centeredness that, you know, I like this coffee black.
Yeah, I mean, self-centered in a way, but not in
Yeah.
a negative.
And not in a negative. It's
It's a matter of taking responsibility for yourself.
For
Because
yourself.
ultimately, it's your job to take care of yourself.
yeah.
And I know we talk. It's very different when a medical provider says to you, "I recommend this. I think this is good for you."
Yes.
The the research and the evidence suggests this, the standard of care suggests this, versus somebody saying, you need to do this. You must do this.
Yes.
That's very different. And that can
And I have friends, like I said, that they live off of that. They live for someone telling them, okay, you're taking 4 Percocets.
Mhm.
Well, maybe you need to take 6. Okay. You know, what do you need? Does 4 work or does 6 work?
Yeah.
Does 8 work? Does what do you think works?
Yeah.
Because if you're just numbing yourself,
Yeah.
you know.
So you tried that before? You tried this kind of medication?
Oh, yeah, I've tried.
Where are you now with the pain medicines?
None. The most of them they've given me do the numb.
Yeah.
They numb me. They make me more. I can't think.
Yeah. Mm-hmm.
Could I sit in a chair and take pain medications all day long? Yeah. Could I sit there and drool down myself and
Mm-hmm.
yeah, I could. But I'm not.
That would be no quality of life.
That'd be no quality of
You're
life.
not functioning either.
Yeah. So, yeah, with the pain meds, and with the pain meds come constipation,
Yeah.
and all that.
Yeah.
And no, that's not where. And like I said, I have pain some days. It's hard to get out of that bed. I now have. They've installed. There's like 2 metal U-shaped things connected to the side of the bed, so when I get up, I can wrap my hands around them to help myself up. Yeah, the pain can really take a good part of me getting out of that bed to get my shower in the morning.
So you do so well with managing it. Someone else may not do so well. So when you mention a friend who's taking 4 Percocet and then going up to 6, you can see where that's heading. But what if somebody goes from 4 to 2 and takes some medicine but attains a balance?
And that's a good thing. That's a good thing.
Okay, so he or she might benefit from that.
Yeah.
It's not for you, but it could be for somebody else.
For somebody else.
But you can also see the escalation, the increase, that in the long run, that's not going in a good place.
And the escalation of it is a person giving up.
Okay,
It's the
frame of mind.
It's the frame of mind that I'll just keep taking more. I'll just keep taking more. You know.
Mm-hmm.
You know, and we all know with the pain meds, you build up a tolerance. So then they start, and like I said, you know, they want more, and they're not dealing with what's wrong with them.
They're counting so much on the oral medication that
Yeah.
they lose their perspective on what they can do.
Yeah.
Need to do.
And like I said, it's like the walking. You know, I have fallen quite a bit. Some people would say that's pretty dumb. Pretty dumb that I won't just put myself in the wheelchair and roll. But it's me. It's what I want to do. I'm sure there's a time coming to where I'm sure. You know, I'm not. How would you put that? I'm not dreaming that I'm going to wake up one morning and I'm going to be fine.
Yeah.
But at this point in time, I like walking. I don't walk pretty, but I walk.
Well, then it comes back to the functioning again.
It comes back to function.
Yes. And the quality of life, because you don't want to commit yourself to a wheelchair.
Yeah.
When you can still walk.
Yep.
I mean, falling is a consequence that happens sometimes, but if it does get to the point where it's too much, then you say, well, maybe we have to consider the next.
Yeah. But I like the pain management here. When I talk to Jen and
Dr. Dimitri?
Dimitri. Yeah, Dr. Dimitri. They promote to keep going.
Yes.
They offer pain meds
Mm-hmm.
if you need them, but they promote, water therapy.
Yes.
You know, and I have a hot tub. I go to to different places. I have planned right now to go to Mohican State Resort.
Fantastic.
Have a handicapped room. I'm going in the hot tub. I'm going in the swimming pool. I'm taking my wheelchair. But it's the part of enjoying life.
Absolutely.
We make these trips every so often to enjoy life.
Yeah,
Is
you
it-
mentioned nature and being out and
Yeah. Hocking Hills, they have 2 places now that are completely concrete pathways that my wheelchair can go. I walk what I can. I wheel what I can.
that's a good point.
But
If
I'm
you
going-
use a wheelchair some, it doesn't mean you have to stay in it all the time.
That's right.
Yeah.
I'm going to enjoy life to its fullest in my world. And that just makes me happy. It makes me happy to go sit at a picnic table and have iced tea.
Mhm.
You know? And I am that person that I love to have a beer every now and then.
Okay.
So, like I said, you sit back, enjoy nature. Yeah, the pain, like I said, I got, walking down this hallway. You know, it really,
I could tell that
oh,
it was present, the pain.
Yeah.
Using the numbers, where would you say the pain would get to walking down this?
probably 9.
That's high.
When I get to
Okay.
that door, that's why I said the one day I was a little grumpy because I had to park all the way in the parking lot at the other side and I had to walk that distance.
Oh, my.
That's a little much.
Yeah.
So when the guy at the door asked me, "Would you like a wheelchair?" It was a hard thing to say no. It's like I still want to, but yeah, there's times.
Yeah.
But
But you see that as just a reflection of the situation you're in, and that 9-level pain is not a reason to panic. It's not something that says you shouldn't be doing what you're doing.
yeah,
It's something to manage. Now, you wouldn't want to maintain that, but
No.
you say, I'll get to where I'm going soon, and then the pain will go down.
Yeah.
Because you'll handle it.
when I sit,
Okay,
you know, I still hurt, but not as bad as when I was walking.
sure.
But even that comes to, like, now it's sitting here. It's like I'm looking around. It's like it's a very comfortable place to sit. I have coffee, have good company, good conversation.
And if you have that appreciation,
Yeah.
it sounds corny maybe, but the attitude of gratitude.
Yeah, the gratitude every day. I mean, it's like when you meet someone and how's your day?
Mhm.
You know, if you're worried about just your day and you're not worried about anything else, it's kind of miserable, really. It is. I mean, it's like it's all about you, and it is all about you, but
But how do you mean that? I know there's a distinction you're saying, but how would you clarify that?
it's all about you because what you like and what you want, but you still got to be considerate.
Excellent.
You still have to be considerate about other people. You're not kissing anyone's butt, but you're being considerate. You know,
I was saying that I heard that when you were talking about falling at the store, how you don't want them to freak out.
Yeah.
At least freak out more than they are because you fell. And I remember when we talked about that, there's a wide variety of responses. An employee there said, "Oh, I want to help you up, but because of COVID, I'm not supposed to touch you." Another bystander saying, "Are you going to sue them?"
yeah.
I mean,
Yeah.
the range of responses right there.
Yeah, it's wild because like the associates like, well, due to COVID and other things, I'm not allowed to touch you or help you up. Okay, I understand that, you know, the legal part of that. But this guy walks up and he looks at me and he goes, "Oh, are you gonna sue him?" And it's like, no, I just want to get up off the floor. You know, I look like, as I told you, I look like a mad squirrel on the floor. I mean, it's like,
Yeah, I mean, falling does set things in motion.
yeah, you get your legs in I get my legs in a real bad position, and it's really bad. And, but no one came over.
Nobody literally came over and helped.
Nobody.
COVID.
You know, they walked by, and like I said, they're looking at me like I'm a freak. I mean, it's like, and
That's really unfortunate, yeah.
it's very, and like I said, it's just someone to say, "Can I help you?"
So in that situation, with such a wide range of responses,
Mhm.
you can't take what others do personally. There's
Hmm.
no way that what they do means anything about you.
No.
How you respond to it means something about you, and I think that's when you say about it's selfish. You take care of yourself.
Yep.
You are aware of others and considerate, but you can't take their behavior personally.
You can never take anything personal. You know, I tell you, if someone told me I was an idiot, you're an idiot. I've had people tell me that a few times. Of you're an idiot. Okay, I'm an idiot.
Mhm.
That's not who I am.
No.
It's not what I am.
And you know that.
And I
Yeah,
know that.
yeah.
I mean, that's their interpretation of the situation, of what's going on. It's not me.
Yeah.
I've been called derogatory things. I mean, cripple. I'm sitting at a table and, someone look, that cripple shouldn't be here, and it's like, oh, well, I'll be the best cripple you ever seen. I mean,
So you take it and you turn it around. You don't let it get to you. You just let it bounce off, go by.
yeah,
And so when you are considerate of others, that certainly doesn't mean that you have to take to heart what they say or do,
right.
or what they don't say or do.
Yeah,
And the thing that's very common is somebody who looks good like you, well, you don't look sick, or
yeah,
you look like you're fine.
yeah. My thing about that anymore is I do spend a lot of time when I get up and I put clean clothes on and I try to be the best of me in my appearance and everything I do. I've been told by people, well, you really don't need to shower every day. Okay. Well, no, you can go a week. You don't do anything. You sit in that chair there, you can go a week without a shower. No, you could go a week without a shower. Steve gets a shower every day. If I can. I mean, maybe Steve gets up and he can't get the shower today, but I get my cup of coffee.
Yeah.
But Steve is putting clean clothes on. Steve isn't putting pajama pants on. Steve isn't putting a muumuu on, because, well, it's just easier to put these sweatpants on and, I'm not going to wear shoes, I'll put flip-flops. Well, if that's your world, if that's what you want, okay. But it's not my world.
Yeah, live and let live.
Live and let live. But my world is, I get up in the morning, I like a shower, I like being shaved. There's days I get up, I can't use my hands. Linda got me an electric razor. Would this help? Give it a try. And I try.
Yeah.
But like I said, it's all those little things that you do for yourself to keep your day going. And like I said, it's just, I go back to a lot of my friends when I look at how they survive, and it's not surviving. It's not even existing. It's pretty, they sit in a chair for 8 hours a day. And yeah, it's like, come on, why don't we go outside and sit on the,
So you'll encourage them.
I encourage
you
people
ask
that,
them.
come on outside and sit for a while. Get a cup of coffee, get tea, get a beer. Come on out, sit on a park bench for a little bit. No, it's just too bad today. Well, and where I get to I'm trying to think what the word is. I sometimes can be I have a lot of health problems. So when someone that I know and their health problems, they have arthritis, and I can't. I can't do that, Steve. I'm not you. Well, you're not wearing any braces. Your arthritis, as I know, isn't as prevalent as mine. You just don't want to.
It's a choice.
It's a choice to sit there. You sit there and don't use your body, it's going to get bad. It's going to get bad.
Yeah.
You have to move.
Yeah.
You have to move. If you start getting to where you're sitting somewhere for Oh, I do that too. If I sit for 45 minutes to an hour,
Yeah.
it gets hard to get up. I mean, you know, and these people, like I said, I'm sitting there talking to them. Well, let's go outside and sit for a little bit. And they live in ranch styles homes to where they can just walk out the door. No, I'm just going to sit here. My case manager tells me that I don't have to. They got me this beautiful lift chair. They got me this pee jug. Your bathroom's right there. It's just easier to sit here and use this. I'm sorry, I have 10 pounds of steel on my. I'm going to the bathroom. I'm not sitting in a chair. And sometimes they get angry with me. It's like, well, you don't understand. Well, I don't understand your situation, but I understand mine.
Yeah.
I understand where I've had to get up out of a chair. I spent 3 years in a wheelchair when I first was injured. And I understand 3 years. And I understand catheters. I understand diapers. I understand all that to where it was a have-to situation. At that time.
Yeah, for an extended time.
For an extended time, And like I said, I could have stayed there. I could have stayed and rolled around and just had myself waited on. It's not what I wanted.
That's not who you are.
It's not who I am. No. And when you turn yourself into that person that's always the needy person, and I think it's the entitled.
Oh, okay.
Yeah. Entitled. I'm entitled to that wheelchair. I'm entitled to that lift chair. Yeah. I'm entitled to,
Yeah. Well,
no.
Well, I think, too, the entitled reminds me of a perspective that when people do have illnesses and pain, oftentimes they see themselves as victims.
Yes.
When you mentioned putting on the sweatpants or the pajama pants and just wearing them all the time, it's almost like wearing a uniform of disability. And they lose the perspective that they're a human being who has a condition.
They lose themselves.
They lose themselves.
They lose themselves.
And the entitlement is more a matter of, well, I'm a victim, I deserve this, or I had this coming to me.
Yeah.
And so I should just be passive and dependent and helpless.
Yeah.
And that just makes things continuously worse, both physically and mentally.
Mm-hmm.
And I think it's when you say friends, these are people you've probably seen over time, and you've seen what's happened over time.
Oh, like I said, I've watched my one friend. I grew up with him.
Oh, my.
I grew up with this man.
Yeah.
And he was in an apartment, and he went from walking to sitting in a chair to not moving to having a home health aide that brought his food to him in the chair. He didn't move. He was, I think he's 57, 58. Now he's in the nursing home because his body is so, he can't move very well. I mean, he has done this to himself, but he got to that point by, well, it's just easier to sit here. It's easier for them to bring me my meal. Oh, look, my case manager got me this nice little tray to where I can just pull it in front of me.
Yeah.
You have a beautiful dining room.
Just over there.
Just over there.
Yeah.
You have a bathroom. You have a beautiful bedroom.
Right there. Yeah, on the same floor.
On the same floor.
Yeah. Mm-hmm.
Well, I haven't slept in that bed in probably years. Where do you sleep? Well, usually in the chair. And then end up in a nursing home, and I only contact him now about once a week.
Yeah.
Because I get tired of hearing him whine.
Yeah.
Look what they've done to me.
Again, that victim mentality.
Look what they done.
Yeah.
You're the one that wouldn't get up. Mm-hmm. You're the one that was so proud of that little tray they set your food on.
Yeah.
Now you don't have to get out of bed. You ought to be happy. You ought to be just peachy keen neato because now you can lay in bed and they put the tray over you and you don't have to get up. But
I can hear that's hard for you to see that.
Oh,
it's really, really tough.
It's really, and a person I've known for that many years.
Yeah.
And I know he could get up.
Yeah.
I've seen him move when he's wanted to.
So literally, he has the capacity.
He has the capacity.
Okay.
He has the capacity to do it but he plays that victim.
Yeah.
And like I said, the one time he's sitting there and I had to leave. It was like, well, they forced me to sell my place.
Yeah.
They forced me to stay in here. I have too many stories over the years of people that they were in those situations and brought themselves out, that were in the nursing homes and decided to, like, this ain't no life for me. I want to go. I want to go places and change it.
Mm-hmm.
So you can change it if you want. Or you can sit there in a chair and cry, you've been abused. Look what they've done to me. No one does that to you but yourself. And anything you do, you drink the cup of coffee black because you want it black. If you want cream, all you have to do is ask.
Right. Well, that goes back to what we were saying a little bit ago about making choices, that you can talk with your doctor. Doctor makes recommendations, but ultimately it's your choice if you do or don't follow along and get a procedure or take medication. It's your choice, and you try to make good choices. You learn from trial and error. You grow from experience. Or on the other hand, some people from experience, they just continue to decline.
Yes,
depending on the choices they make.
And I've had surgeries and like I said, I had one surgery and the doctor said, this will correct the problem. It's going to correct it.
Sure.
Okay, so I had it.
Yeah.
Made the situation worse.
Yeah.
And then when I'm sitting in the room, it's like, that's awful. That's awful strange. Well, you told me that it would correct it.
Yeah.
You can't promise something that you don't know. Everything's different in life. I'm different than you. You're different than him.
Yeah.
Him's different than her. I mean, you can't do everyone and say, this is going to work. And like I said, it was like one thing after another of trial and error.
Yeah.
And I just decided, okay, I'll listen. I'll research. I'll see how many people have had good out and bad out. And, well, I just decided I'm not going to do that. I'm happy where I'm at right now with what I take, the medication I take and everything, And the best thing about that is having a doctor that listens.
Huge.
Because I've had doctors that don't listen, that simply sit there. The one doctor I had that looked at me and goes, well, you look so good, you can't be sick. I have a chart, and take the chart and go, well, that really doesn't matter.
Yeah.
It does matter, but I look good because I chose to get up and get a shower, shave, and come in here and look the way I do.
Yeah.
Just because that person over there decided to get up and put sweatpants on and a t-shirt and sandals, that's their choice.
Yeah, again, live and let live.
Live and let live. But that doctor would never give me my opinion.
Well, the provider who doesn't listen isn't really going to be able to provide the kind of care that's best for you.
Yeah.
And I think every doctor has good intentions and education, training, and wants to help, but that's a process that's involved. And you're ready, willing, and able to do your part of speaking up, knowing yourself, communicating, doing your research, talking, exploring, and so on. But it is really critical that even if a doctor is ready, willing, and able to listen, the patient has to speak up. And
yes.
You do.
And
you're very good at communicating, too.
There was a time that I didn't, though. Like I said, we go back in the beginning when I was first hurt in the car accident. The psychiatrist I was seeing, I still see him today.
Yeah.
And he's very impressed because his comment was, you were Charles Manson. He goes, you were Charles Manson sitting across that table from me. He goes, you scare me. He goes, when you come through the door, he goes, I didn't know what was coming out of your mouth. He goes, I didn't know where the conversation was even He goes, you went from Charles Manson, you're Mr. Rogers. He goes, I sit across you now. He goes, I'd take you home with me. He goes, I'd take you home to meet my wife and kids. He goes, back in the day, he goes,
what a transformation. And that's due to
just time, trial and error. I mean, it was like time, in the wheelchair, time, with the chemo, the cancer.
Were you bitter and hostile?
I was that person that blamed everybody.
Okay.
It was everybody's fault that I was
In that situation.
in that situation.
State. Yeah.
And I wanted, like I said, I wanted someone to pay for it.
Mm-hmm.
And not money-wise. I just wanted someone to pay for
yeah. Your suffering.
my suffering. It's
There's
like
no dollars that would do that. You just wanted somebody to suffer some consequences.
Yeah, I wanted someone to sit there and have to feel the way I was, to the pain of, and I learned in time, like taking the medication, I could take 20 medications a day, and, medication isn't bad. It's not a bad thing,
Right.
but how I was using it was a bad thing.
Okay.
Because I was taking anything. If I walked in and I said, this isn't working, I'm feeling pretty, okay, give me 125 more milligrams of that. Give me more of this.
Yeah.
I was taking, 7 and 8 different psych meds.
Oh my.
I mean, it was like, I wake up and it's just miserable. I can't even open my eyes. And it's like trial and error to where I get up now and I think, I'm going to get a cup of coffee.
Where have you come from the 7 or 8 psych meds to where are you now with psych meds?
None.
Well, you had that experience with a thyroid medicine.
I had the thyroid medication that
You tried that twice or 3 times, 2 or 3 different trials of it. And
on a 4th one now.
on the 4th one?
Yeah, I tried the 4th one and it doesn't work.
And you're finding that you're functioning
without it.
Yeah.
Again,
and
that
it might be said that's impossible.
It's impossible.
As we talked about, that there's a difference between saying that you can't be, or that can't be, or that's impossible, versus that's remarkable, or that's unusual.
Yes.
Because it's not all or nothing, either or.
And with the human body,
Yeah.
everybody is different.
Yeah.
So it is possible.
Yeah.
It can be amazing that someone over here has to take a thyroid medication that doesn't have a thyroid, and here's this individual over here that doesn't have a thyroid and hasn't taken thyroid medication for over 2 years.
And is functioning.
And is functioning every day. And when you go into the room and the person, the endo doctor looks and goes, that's impossible.
Yeah.
There is no way you're not taking some supplement. No, I take and I did that time when I took the bag of medication. I kept every bottle of pills I got from the pharmacist, carried them in, set them on the table. And again, the wording to me was, that's impossible. How's it impossible if I have the medication?
Well, the word impossible ends the conversation. If it says that's unusual, then you can explore further to see what might be going on. I mean, it's an opportunity if you both parties allow it. Now, you're willing to explore it and discuss it. Obviously, express yourself well. You speak, you listen.
Yeah, I would love to sit down and have a very wide conversation about this with a couple endo doctors.
Yeah.
Because it is very unusual.
Yeah.
That I feel better not taking the medication than I do taking the medication.
And you recognize it is unusual. You're not arguing that.
Oh, no.
But to say it's impossible is against reality because you're living proof of what you're saying is true.
My legs, I got pins and things sticking out of them, because they're just worn out. And it's impossible you walk. You see me come down the aisle. I mean, the hallway. It's not impossible. It's amazing.
It's unusual.
It's unusual. It's amazing.
But
never what's impossible for you to walk.
Yeah, and I know you, Steve. It's not like you have a big head. But when somebody says that's remarkable, that can feel good because it's effort.
Yeah.
It's who you are as a person. It's an extension of your makeup and your determination. But to say it's impossible, in essence, is saying either you're deluded or you're a liar.
Yeah.
You don't know what you're talking about.
Yeah, and it's
the end of conversation.
It's never getting a big head about anything that you can do.
No,
it's the feel good in your world of who you are. It's like, wow. Again, I walked all the way down here. it gives me a good feeling that I made it
It
from there
gives you a good feeling.
without a wheelchair.
But just as we were saying a little bit ago about not taking personally what other people say or do, that includes positive things. So if somebody
Yeah.
says, that's remarkable, you don't feel like they're patting you on the head. And
No.
now you're just Mr. Wonderful.
Yeah.
It's not that. But it's an appreciation of, well, yeah, appreciation of you're listening to what I'm saying and accepting my reality.
Yeah.
And it is a reality. And to
And
say
that's-
it's impossible is not.
And that's the part of when you talk to people, you can understand them a little better when they do that.
Yeah.
You know they're on
Well,
the
you
same
have to.
they're on the same basis as you when oh wow. We'll have to read into that and see, wow, I'm gonna study that a little more and see how many
Yeah.
people can do this because
Yeah.
you know, if you're doing it, other people might be doing it. My health is declining. You know, things are changing. But that doesn't mean I have to change it who I am. This is who I am.
Who you are is a combination of your whole person,
That's it.
and there's things that are operating within your body. Like you said, I have arthritis, I have these other health concerns. They're labels to describe something that's going on, but it doesn't define you as
Yeah.
a person.
Yeah.
Who you are as a person can deal with those things.
I have cancer.
Especially you can.
I have cancer.
Yeah.
I have arthritis. I have a Medtronic's implant in my spine. I'd have to sit down and get a book. I mean, I have so many things that's going on, but none of them defined who I am. And even that back in my implant helps me walk.
Mm-hmm. Excellent.
When I had one of my strokes, and I've had numerous, I fell down 15 stairs backwards, knocked myself out, and damaged the implant. When I went to the neurosurgeon, he put it in. I was diagnosed with the cancer then.
Okay.
And the insurance company said, basically they weren't going to do it because I wasn't a value. We're not going to do it. We're not going to put it in a dying man. You're going to have to stay in a wheelchair. When I was talking to him, and I told him, he goes, Steve, I've applied this like 5 or 6 times. He goes, they're not going to pay for it. And I said, okay. He looks at me and he goes, okay, yeah, I guess I'm just going to be in the chair. How can you be so to sit in the wheelchair? It's a choice. I could sit here and be angry. I could be mad. I could just be fuming. I could make 100 phone calls a day. No, I'm not wasting my time. I'm going to sit in this chair. I can sit in this chair and I can roll around and I can be me.
So you can make the best of that.
I can make the best. If it came that, I will make the best of it.
What turned out with that?
That one was, I went back. I got to get his name for you too because he was a wonderful man because I went back and he looks at me that day and he told me, he goes, I applied it again. They refused. He goes, I am going to pay for your surgery and the implant out of my pocket.
Oh my goodness.
He goes, but there's one stipulation. He goes, I want to be able to write a paper. He goes, I want to write a paper how that the insurance companies are treating human life.
That's striking, yeah.
He goes, because everybody has value.
Wow.
Whether it's one day, whether it's a year, whether it's 20 minutes. He goes, and I'm a doctor. He goes, I'm not an insurance company. He goes, when you give the power to the insurance company and take it from me, I don't want to be a doctor.
Yeah.
They can be the doctor.
Yeah.
And he goes, all you have to do is tell me, you'll let me write a paper on how I felt this was horrible. He goes, this was horrible. He goes, because your cancer diagnosis doesn't say you're going to die. You might.
But you might not.
You might not. That was 5 years ago. Longer than that. He goes, so we're going to put the implant. We're going to do surgery and I'll pay for it. I went, I had the surgery. In time, I was back up on my feet again. He come to me and he said the insurance company came to him and said they would pay if he would not do the paper. And he goes, well, they're going to get part of what they wanted. He goes, but I'm going to put it in a newsletter.
Okay.
He goes, I'm not going to write the paper I said I was going to write.
Yeah.
He goes, but I'm going to put it in a newsletter to my other colleagues just to tell them that everybody has value, whether it for a day or a year. But you would do better if you were on your feet.
It sounds as though he could tell that not only would it do better for you to be on your feet, but that you would go with that.
Yes.
You would not just get the stimulator replaced and then just go back to the wheelchair. He knew that you were a determined,
Yeah.
motivated person.
And that's my motivation today, that everybody in the past that has worked for me to keep going, it empowers me.
That's a perfect word.
Everybody wants to see me continue. I could die in a week. The cancer could just... But I'm going to be the best who I am for the people that are around me. They enjoy who I am.
And you'll make it the best week you
And
can.
I'll make it the best week I can.
Yeah.
And like I said, it's with everybody I come in contact with, the doctors and that work with me. I appreciate them 100%. I'm grateful to have them.
Yeah.
But if I go to a doctor and, like I said, you've seen reports where they say I'm disgruntled and things like that. Non-compliant. I will change that doctor. Nothing against that doctor.
Yeah, again, live and let live.
Live and let live.
It's not working out for me.
That's right. Your opinion's your opinion of me. But I want to go into a room and sit down with a doctor that says, yeah, you should be in a wheelchair, but if you don't want to be in that wheelchair, I'm going to get you some braces.
Yes.
I'm going to get you braced up. If we have to stand you up with a walker, if that's what you want, we're going to do our best to get you what you need.
It's not an either or.
Yeah.
It's not an all or nothing. Let's look at what the
Let's
options
look at
are.
everything
Let's look
we
at the
can do.
alternatives. Yeah. Let's look at the big picture and
Yeah.
then go from there. And you're ready, willing, and able to do that.
Yeah.
And so many patients are able to do that. But there are those who have trouble with that. And I think that if they consider what you're saying, then they might have a different way of looking at it, and to know that you didn't always look at things this way.
Yeah.
You from trial and error, taking time.
Well, you know, my other counselor, he had a bad fall.
Oh, yes.
And he come to me and was telling me that I inspired him.
Yeah.
He goes, Steve, he goes, all the stories you told me, how you've been down and out and, you know, the pain and all that. And he goes, I'm laying there and I'm thinking, he can do it.
Yeah.
You know, the doctor story where he says, I'm sitting in a room.
Yeah.
And you know, he's a licensed psychologist.
Very, very experienced.
A very experienced psychologist.
Yeah.
And the doctor's talking to his wife about putting him in a nursing home.
Yeah, with him there.
With him there.
Yeah.
And it's like, oh my God. You know, it's like, he goes, your stories come back to me. He goes, I'm sitting there listening to one of your stories you told me about. You know, and it's like, I was amazed. He goes, I never thought in 100 years that I would experience something like this. And he goes, it's happening. He goes, I'm not even in the room. He goes, I'm a very intelligent individual. He goes, and the doctor's talking to my wife about putting me in a nursing home.
Yeah.
He goes, that's scary.
Yeah, he could see what it's like
Yeah.
to be on that end of it
Yeah.
at times. And he has an appreciation. And, you know, we're all humans.
Yeah.
We're all humans. And, you know, we're coming up to the time we have here for today, but I just want to say I'm honored to be part of your team. So
Thank you. And I'm honored to be here, so.
Thanks again for agreeing to do this. I really think it can make a difference.
I hope it does with a lot of people, because there's people I talk to and some change.
Yeah.
And some choose not to. But that's who they are and that's who they're going to be. And
But it's your way of showing that you do care and want to extend to others as is possible.
Anything's possible.
Yeah.
No matter what the situation is, it's possible.
Just don't give up.
Just don't give up.